Hello and welcome to another edition of Professor Speaks. Today we're going to be talking about influenza with a special guest, Dr. Mark Walberg from University of the Pacific. But before we get into that, I'd like to remind you to hit like, subscribe, and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And our special guest today is Dr. Mark Walberg from University of the Pacific. Thank you for joining us, Dr. Mark.
Thanks for having me.
Dr. Mark, Dr. Walberg, Dr.
I like Dr. Mark works.
Dr. Marky Mark? No?
Bring it.
Craig maybe said that. So anyways, our topic for today is influenza. And we talked about it back in October. And we talked about the flu vaccine a little bit. But we want to go more in depth, and especially with our special guest. Actually, Dr. Stern, do you want to...
Yeah, let me just give a quick intro here. Mark is a colleague, professor at University of the Pacific, and we, because of our academic affiliations, we've known Mark a long time. Mark is an expert in vaccinations, both travel medicine as well as common ones, and we thought that we would deal with this in two fashions. One is we want to deal with influenza vaccine because now is the time, and certainly from a disease standpoint, now is the time. And then secondly, we're going to do another one with regard to travel vaccinations so that we can kind of cluster this with an expert on our side. So that's what we've done.
We were going to surprise you with the second part, but I guess cat's out of the bag now. So for our topic for today, we wanted to talk about why the flu shot is very important. And why it's important to get every year. So Dr. Mark Walberg, will you help us with that?
Yes.
Why is that important?
Let me ask you a question first. Do you like shots?
No. I hate shots.
I don't know anybody that likes shots, to be honest. I hate shots. I hate getting them. 15 years ago, if you asked me, I would have never said, oh yeah, I'm going to know a lot about shots. I've trained and given probably over 10,000 at this point in my career.
So do you like giving them or receiving them better?
I would rather be on the less pointy side of the needle, to be honest. No problem giving them. I give myself shots and I still don't like it. But, you know, really it comes down to when we're in medicine, pharmacy, any healthcare, public health, it really comes down to preventative care is really where vaccines lie. And they're very different from a lot of medication that we have is because they prevent the disease before the disease actually happens. And that's really where they're so beneficial because how many diseases do we have that have well-established, well-researched, safe, and effective means of preventing them before they even occur? So yes, I am very pro-vaccine because the data support it. Right. I get it every year. My kids get it every year. I try to get my wife to get it every year, and normally she does. But yeah, no one likes it, but it's incredibly important that people get their flu shot and all of the recommended vaccines to make sure they don't get a disease.
And this is Vaccine Week, right?
This is the National Immunization Week, Awareness Week. So if you have not gotten it yet, looking at the epidemiology of it, it looks like it's starting to go up this year. So I would highly recommend you go out and get your flu shot if you have not already. That's not if you feel like it, you need to go get your flu shot.
Right, and you mentioned preventative, like this is all for preventative, to prevent you from getting the flu.
Correct.
But what if I'm an extremely healthy person? Because I'm very healthy, I work out sometimes, and you know, I very rarely...
Sometimes. Asterisk that a little bit.
I'm sure you can tell. But anyways, we talk about prevention and those that are healthy and they rarely get sick. I mean, I don't get sick all that often, except when I call out. I really do get sick. But the extremely healthy adults that feel like they don't need it. Why is it important for them to also get the flu shot as well?
Sure. I mean, if you look at all the years of flu that we've had, the highest risk patients are typically the very young and the older patients, specifically those that have a lot of other chronic diseases. So if they have heart disease, pre-existing lung disease. But what we've been seeing, especially with the H1N1 that's come back that was previously circulating from the Spanish flu at the turn of the century all the way until the 50s. When that came back, we really started seeing additional demographics of people that were affected. And these are young, healthy adults who were dying of influenza. Two groups of people there as well were pregnant women and obese patients, in addition to the typical patients that have these chronic diseases that put them at higher risk. But, especially the first few years when H1N1 came out, there were a lot of pregnant women who were going directly to the ICU, and a good number of them were not coming back.
I think a couple of really important questions we should talk about is, one, are students required in public schools to get a flu vaccination? And if yes, fine. If no, why should they? Why should the parents care?
Sure. So in most schools, to my knowledge, it's not required. Many of the standard routine vaccines, such as measles, mumps, rubella, polio, tetanus, pertussis, those are required. However, I've never seen flu vaccine on a large scale be required at school. But let's think about this disease a little bit. It's a respiratory disease, correct?
Okay.
And if you are that healthy, maybe even older child or young adult, you might get influenza and have absolutely no symptoms. So you might just feel a little funky that day.
Right.
But meanwhile, as you're going through your day and you might have a little bit of a cough, you're actually spreading virus all around. Now let's say you're in a school setting and you're sitting in a confined classroom for even an hour at a time if you're a college student, if you're younger in elementary or grammar school, going all the way up to high school, you're in these confined classrooms for a good portion of your day.
Right.
And this is why, think about enteroviruses that goes through school, or back when I was a kid, varicella, chickenpox that went through. The entire class would come down with it at the same time. While influenza might not be as contagious as things like measles and varicella, it's still contagious, it's still deadly. And so having even perfectly healthy adults or children in a confined space or in a classroom setting for any length of time, you're just really increasing your odds that if one is sick, that entire room is going to be exposed.
Last year, which was a horrible flu season,
Absolutely.
about 83,000 people died, and the vast majority of them were not immunized.
Correct.
So we've talked in the past about herd immunity.
Right.
Do you want to make a comment or something to people about that?
Sure. Vaccines are a little bit different than most medications again, and I do lump vaccines into medications because they're just like a lot of other things we use, except again they're preventative. And there are two ways to look at a flu vaccine. One is as an individual, one as a herd type mentality. Now, if we look at the herd mentality, if I'm a perfectly healthy adult, but somebody else might not be, say they're going through chemotherapy, say they've just had a transplant, say they have asthma or COPD or something else that might compromise their ability to deal with influenza, if I get the vaccine, maybe it'll benefit me, but it'll also help me be less likely to spread that disease to somebody else. There have actually been studies in nursing homes where they looked at vaccinating the elderly residents versus vaccinating the people that care for them. And again, the caregivers are going in and out of that facility, potentially bringing in external pathogens, whereas the residents are really staying localized to that facility. What they found is that there were better results vaccinating the young, healthy adults that could have a very robust immune response to this vaccine versus the elderly patients who maybe couldn't mount as good of an immune response. Now, that being said, the healthy adult, there's data that shows you're less likely to get the influenza, even on a bad year. Still cuts your risk by about 25%, which is better than most medications in terms of treating a disease. It decreases your chance of being hospitalized, and it decreases your risk of death. So I always look at vaccines as this decreases your chance of getting sick, hospitalized, or dying. If we look at the adverse event side, it's about a 1 in a million that you would have a severe adverse event. So the odds are highly in your favor to get the influenza vaccine every year.
There are so many angles I want to go to in that one, because including, of course, the conspiracy theories around it. But I'm going to avoid all that and get into what's really important, which is the symptoms. People want to know what the symptoms are. And what are some of the symptoms of the flu? Because I want to make sure that the viewers and the listeners out there actually know what symptoms are. And well, we already talked about preventative, but let's just see if they can identify if they have it or not.
Sure. The easiest way that I identify influenza compared to like the common cold, which again, a lot of these diseases come up at the same time of year. Everybody's getting runny noses around now, right as influenza's picking up, is a cold will come on fairly gradual. Mm-hmm. You'll get a lot of the sinus congestion, maybe a little bit of cough.
Maybe lose your voice a little bit.
Yeah, you might feel a little funky for a couple of days. And it might go out you might have symptoms for weeks. Mm-hmm. Influenza, the way I actually used to, quote unquote, diagnose this is when somebody would come into the pharmacy and they said, I feel like I'm going to die. Mm-hmm. That's influenza. It typically comes on very quickly, very high fever, with the cycle of chills and the whole rigmarole, the muscle aches that'll happen because of what that virus is doing to your body and what your own immune system is releasing. Mm-hmm. You're going to feel miserable. Headache. If you are prone to headaches, you may have really bad migraines from this. Typically a very sore throat with a cough. Maybe you might be coughing stuff up, maybe not. You might have a little bit of sinus stuff going on, but it hits you fast and it takes you down. My own wife had this a couple of years ago because I'm a prophet in my own home, and she didn't get vaccinated one year. And she said after her 3 days of misery, she said, I understand why people die from this. And she was middle-aged, in her 30s, no comorbid disease, perfectly healthy. Mm-hmm. And she understood how severe this disease could be. And again, there's your middle-aged, healthy adult who has it. Now, clearly, if you're unhealthy, good chance you're going to end up hospitalized.
Right. What about the guy who gets the shot, but still gets the flu?
Absolutely.
We've talked in the past about the fact that it covers about 6 of the different variants. There's maybe 144 of them and all of that, talking about the super vaccine.
Sure.
What's your thoughts about that?
I would love to have a more effective flu vaccine.
That is simple.
And have a less number of shots is always something. I mean, ask any pediatrician about how many shots they have to give a kid, and they wish they could always combine them and give less. What we try to do with influenza is we try to only vaccinate against the strains that we think will be circulating. Influenza is very different than something like polio or measles, which pretty much we've had 1, or in the case of polio, 3 vaccines, and they've covered it for the last 50 years.
Right.
Influenza mutates very rapidly, and the more people that get infected, actually the faster it'll potentially mutate because it's replicating that many more times.
Right.
And it changes the protein coat that it has on it, and that's really all our immune system can attack. We can't attack anything on the inside of it. So as it changes and mutates, our immune system's trying to adapt to it. So what the CDC and the WHO actually try to do is they try to predict what the most prevalent strain will be. And in the past, about 10 years now, one of them has been an H1N1 strain, the swine flu that came out, which is really a hybrid of human, bird, and pig flu that's come out. But that's been pretty prevalent. Now, we've also had these, like last year, a different strain, which is an H3N2 strain. And really all that means is that one of the main, or the 2 surface proteins on the outside are different.
Right.
So we have to build a new vaccine for that. Well, then things happen like it mutates, or the vaccine doesn't grow appropriately in the cell culture that we use to grow it, which is typically eggs.
Right.
So there's new technologies coming out to look to build better flu vaccines that'll target a little bit better, but we're still chasing the natural biology of this virus at all times. You talk about a universal flu vaccine. They are looking to target a different part of the protein that doesn't change as rapidly, which, hey, if it gave us 5 to 10 years, that would be awesome. That'd be incredible.
Right.
There are some issues logistically with getting an antibody to target other parts of a protein. There's also, my wife has asked, why don't they just put every protein that we know as a target in there? And the answer is, well, then we're vaccinating people unnecessarily because there's no evidence that that protein is around or doing anything. We only vaccinate for things that we want to actually provide protection for.
Right.
So it's an optimization game of trying to predict the virus and minimize the number of proteins we have to give people, or antigens.
Right.
So the final 1, 2, 3 to inform everybody is get a shot.
Get your flu shot, get your flu shot, and get your flu shot. And tell somebody else to get the flu shot too.
The most important thing to focus in on here is you need to get the flu shot every year because it is changing, as Dr. Mark Walberg has said. The flu is changing. It changes every year. It changes maybe multiple times a year.
It can change in the middle of the year.
Yeah.
Absolutely.
So it's important to get your flu shot. It's not going to cover everything, but it is going to cover the most important or the most prevalent, at least,
sure,
at the moment. And then you also, when you're getting the shot, just don't look at the needle. That helps.
I don't look either unless I'm holding the needle and actually giving it to myself. That's the only time I look.
And where do you go? Where do you go to get a shot?
Where do you go to get a flu shot?
So almost any pharmacy nowadays can offer it to you at almost any time of the day. Just like picking up a prescription, you can get your influenza vaccine and any other vaccine you might need. If you have a scheduled appointment with a other healthcare provider, your physician, maybe you see a PA or an NP, ask them for it. If they don't offer it, you need to be asking for it and get it every year. They recommend getting it by the end of October. So we're already past due at this point. However, especially in the States and where we are in Southern California, we might not have a peak until February or March. So after the holiday season, it's still okay to go get your flu shot. Sometimes people think that after New Year, they don't have to do it anymore. No, right. January is not too late if you haven't gotten your flu vaccine yet. Right. Please get your flu vaccine.
Anything to add, Dr. Stone?
No, please get your flu shots. All of the bad news that's come out about it has all been debunked. It's all nonsense. As clinicians, get your flu shots. The very best way to treat disease, prevent it.
Of course. And we've been stressing that prevention is one of the things we also want to talk about and focus on as we keep going through these episodes, is how to prevent these diseases, illnesses, influenza that comes out. Prevention is number one. And also, talk to your pharmacist. We've always stressed, ask your pharmacist. That's what they're there for. Ask your doctor, ask your pharmacist. If you have questions, something's not quite clear, ask questions, especially with the flu. And I also wanted to debunk, all the bad news, the bad press about influenza that's come out, it's been debunked. You can research it. You can look up many different articles. I'm sure UOP has a site. USC has one. I've seen it where they have scholarly articles that have been researched, and you can find all the information you need. And also ProPharmaConsultants.com, right? We have a bunch of articles that are written by Dr. Stern himself, and we would like to remind you to hit like, subscribe, and hit the little bell for notifications.